Hey guys, I'm Ellie, I live in France and I got a hip surgery. If you're watching this video, it's probably because you have some kind of hip problem, you might get a surgery as well, or you're considering, or maybe you know someone who will get a surgery, or you're just here because it appeared in your feet, I don't know. Well, I'm currently a week and a half post-surgery, we're at day 11. I quite honestly did not feel well enough to film after the first week an entire video. In this video I want to be as honest as possible. I will share some TMI things that not maybe everyone will feel comfortable sharing. I know some people around me who are like, oh, are you going to talk about that? And I was like, yeah, because I don't care. And it might help someone, and maybe it will not be your experience. I'm not any kind of medical practitioner, I'm not a doctor, a surgeon, whatever. I'm just sharing what happened to me, which kind of surgery they did on me, and how I felt afterwards. So I documented a few clips almost every day, and I will combine them in this video, and then at the end you will have the same faces right now, talking about my experience and the things I didn't share in the following clips you're about to see. So I hope it will help you, and let me know in the comments what you thought about it. Before I just let you with the videos, I might add that my problem that I had, and I had to translate this because I had it in French in my recap of the surgery that the surgeon sent to me afterwards. In France, it says that my problem was un conflit fémoro-acetabulaire, which means in English a femoral-acetabular conflict. He also diagnosed me with hip dysplasia, which I didn't know before, and that caused a labrum tear. So he did a few things on me. He first of all had to sew back the damaged tissue, the labrum that was torn, and then he did a reshaping of the femoral head and neck, so it's called a femoral osteotomy. And he also did a Acetabuloplasty. Oh my god, the terms are so complicated, which just means that he kind of reshaped my bone so it can fit better in my hip. Because of the hip dysplasia, my hip, both of my hips in fact, are not correctly positioned. After sewing the labrum, which is around, he also reshaped my femoral head. I have 3 incisions. Today I got my stitches not removed, but I got all of the bandages off. My nurse came in this morning, and I might share a picture at the end of the video if you're okay with those kinds of photos. It's just 3 incisions, but you can see how it looks. It's very small. It has probably 1 centimeter for each incision. I was quite pleased with the appearance of it. I didn't quite frankly care about the scars. For me, it was about getting better and getting it repaired. With that, my friends, I'm leaving you with the clips of me after the surgery. Good morning from my bathroom. It's 4:45 in the morning. I woke up specifically because I need to take a entire body shower, including the hair, with the very smelly product that smells like hospitals with iodine. And I'll take my time because I need to use it properly, and you need to scrub for a few minutes in almost every single place of the body to make sure you're clean for surgery. I'm really nervous, but I still can realize that today I'm getting the surgery, and I really want to try to not overthink because it's been really hard for the past 2 weeks. My sleep has been awful. I've been thinking about it I have been thinking about it every day, and I just want to be over with it. So let's do this. We'll feel better, and we'll be really proud of ourselves for doing it. It's time. I have my cryotherapy machine, and we're heading to the hospital. It's gonna be fine. I'm really nervous. I just want to be over with it. Give me the Xanax, give me the anesthesia. Let's just get it over with. See you on the other side. We're now out of the surgery. It's the afternoon. I had a little bit of sugar to put me back on my feet after anesthesia. I still feel like I'm tripping from everything, and I'll be able to go home in a few hours, in a few minutes. It depends on how fast I can like stand and put back my clothes, but it went really well. I would say out of 10, my pain on my right hip is probably 2 or 3, so I'm really surprised in the good way. And I had my cryotherapy machine going on for the past 2 hours, and I think that helps a lot. So I'll see you at home. Hi guys, it's now about I think 7 p.m. My surgery was at 9 a.m. this morning, and I want to update you on how it went, on the level of pain and everything. I have by my side my lovely little Bob, which is my companion for this little hard moment. The surgery went really well. I was kind of out of it for 4-5 hours, you know, after the anesthesia. You're trying to stay awake, but you can't. Your eyes just want to close. It was kind of a weird feeling because it was my first general anesthesia in my entire life. I have to say the medical team was amazing. They were really reassuring. At some point when they wheeled me to almost to the operating room, there is like this hallway where there are different people waiting to be dispatched in a room, and I felt really anxious. I cried a little, and this nurse reassured me. It was really nice. The level of care I had was amazing in this hospital in Lyon. So now regarding the pain, I was able to get out of the hospital at around 3 p.m. with my boyfriend. He drove me home. We took the elevator because we live in an apartment, so luckily I didn't have much stairs to climb. And I had my crutches, and I also luckily have a cryotherapy machine, which they didn't lie, it helps a lot. I think my anesthesia completely wore off maybe at around 4 p.m. or 4 to 5 p.m. So now I can tell you exactly the kind of level of pain my hip is in. I would say it's at a 4.5 out of 10. It's manageable, and whenever I put the cryotherapy machine on, it puts down the level of pain to maybe a 3. It's very bearable. Now I'm trying to put some food down my stomach because I don't really feel hungry. I was luckily not I was gonna say anxious. No, that I was anxious. I was luckily not nauseous because that was one of my phobias. I have emetophobia, so I'm scared to shit to throw up. This was one of my biggest concerns, so I had to discuss that with my anesthesiologist, and he was amazing. He gave me some anti-vomiting drugs before the surgery, so I felt really good in that realm of you know, in terms of nausea and everything. But my stomach, you know, was still feeling a bit off because I haven't had food since yesterday, and I was not really hungry, and my head was spinning a little bit. And I've been actually stole this piece of bread from my tray from the hospital, and I have been having a little bit of the baguette since after my surgery. I haven't ate a lot, and then I had some honey because my throat feels really weird because they put the tube in your throat, so it kind of irritated a lot my throat, and I keep coughing, but that's okay, it's not a big deal. So I have been eating a little bit of honey here and there when I can, and when I feel like I will manage to keep it in my mouth. And then I have been drinking. I haven't drank a lot because the same thing, I haven't been really thirsty. I got this 500 ml water bottle this morning after my surgery. I only got maybe half of it, and it's okay. I will try to sip it throughout the evening and throughout the night if I'm awake. And my partner made me some spaghetti with olive oil and some lactose-free cheese. I will try to have at least a third of it. I hope to be able to, and I will do my best to have some. I will just eat really slow to be able to take my pain medication, because I will have to take it, so you need to take it with a full belly or during a meal to make sure it's not too aggressive on your belly. And that's the update, and I will keep you posted tomorrow on how it evolves. And there is one last thing regarding the swelling. I was really shocked at how swollen you are. So I noticed it when I went to the bathroom after the surgery. When I arrived home, your thigh, like my thigh tripled, and the same for my butt cheek on the side. So I hope tomorrow will feel even better than today, and then we're gonna get out of it slowly but surely. Well, have a good evening. I will see you tomorrow. I hope you can see me well and that you can hear me. because I'm currently using my cryotherapy device. Coming at you. Fortunately, I have this really nice medical sofa with this remote. It's really handy. I don't know how I would do without it actually. If you can rent one or borrow one from one of your friends, a recliner chair helps a lot. I think it's one of the best things I have, as well as my cryotherapy machine for my recovery. So the night was kind of rough. I had a bit more pain in my hip than I had earlier. I was like 5 and sometimes a 6 out of 10. I didn't sleep a lot, which was okay. I was just really tired because for the past 3 to 4 days I haven't slept because of the stress pre-surgery, and yesterday I couldn't sleep because of the pain post-surgery, but it's just one of those things you cannot control. What I did is I think I was able to fall asleep at around 1 a.m. From 1 to 3 p.m. I was able to sleep. I had my painkiller that worked. I had paracetamol, which I think helped. And then at 3 a.m. I woke up and I had some pain that I started to feel in my leg. I think the ibuprofen and the paracetamol I was taking stopped working at that time, so I started feeling everything. The best way to describe it is like stab wounds. You can feel where the incisions are, and within your thigh. For me it felt really contracted, the same as when you have like a cramp. But other than that, I feel really great. There's only one kind of weird symptom I had yesterday, which was the day of the surgery, and it occurred at night, and it actually made me a bit nervous. Not a little, it made me truly nervous. I started feeling numbness in my arms, so from my fingers to probably here, and like a little cramping, so I was a bit scared. But today I talked about it with a nurse and she said it's normal, it's the anesthesia. Since you haven't drank a lot of liquids yesterday, you could feel some numbness, so I was reassured that it was okay. And the last thing that kind of bothers me is my throat. It still hurts because they put the tube down your throat when you're under general anesthesia, so it's kind of really irritating. So I'm having ginger tea, honey. I'm trying to not eat or drink really warm foods, not irritate my throat. And at the back of your throat you have something called la glotte. I don't know how you call it in English, but this is really swollen and it actually physically bothers me because I can feel it. It's almost as if I didn't swallow something like a piece of food in my mouth. So this is how I use my crutches and how I sit at home. The first thing I'll do is put on my cryotherapy device. So it's like this little belt. I use it usually for 60 minutes, then 60 minutes off, 60 minutes on. I'm gonna lean to the back and I'm gonna slide my right leg, which is my leg that had surgery. And I'm gonna use my hands to slide back. I basically don't use the strength at all in my leg when I put myself on the couch. Now I'm lucky because I have a couch that is automatic, that has a remote, but the goal is to have my legs straight. It's not really recommended to have your legs at a 90-degree angle. I'll put on my cryotherapy machine, and one last thing, I will put a towel under my knee, under the leg that had surgery, to make sure that it doesn't become stiff, and to make sure that my leg does not move. I'm gonna use a pillow in between my legs like this, and then I'm just gonna put my blanket and I'm gonna chill. Hello, today is day 3 post-surgery, and if I'm laughing it's just because my boyfriend is in the corner and it's really funny to film whenever I'm with someone. It's a bit weird. It doesn't mean that I'm not in pain, obviously, because it doesn't look like I had a surgery, but I actually had. Yesterday was day 2. I needed to talk to you about one thing. I had, other than my 3 medications, so my ibuprofen, my paracetamol, and my gastric protector, I'm taking 2 other food supplements. There is Proteo Shock, that is supposed to help you heal and help you with the wounds. And there is another one that is supposed to protect your liver, which is called Dysmodium. But this is the one that made my stomach upset yesterday and this morning, so I stopped taking it. Dysmodium is an algae from what I understand, and I think I just don't digest algae at all, so I just stopped using that one, and I feel a bit better. I was able to eat today, but way less than yesterday because of the food supplement that made me upset. Other than this, in terms of pain, I would say yesterday and today I'm at a 5 out of 10. It's not bad, but it's a little bit more uncomfortable than the first day right after surgery because of the anesthesia that was still there. So I'm using my cryotherapy machine right now. I'm still doing the 60 minutes on, 60 minutes off. I don't use it the entire day. I usually do 2 cycles in the morning and maybe 2 cycles in the afternoon, and I do maybe 1 to 2 cycles during the evening and at night. I was able to sleep about 5 hours tonight. I did like 3 hours at a time and then 2 hours early morning. Then my nurse came in and she did the injection again. That was really fast. Actually, I have a huge how do you say blue? The pain is okay though. I'm trying every hour and a half, every 2 hours to stand up from the sofa, to use my crutches and do a little tour of my apartment just to make sure that I don't lose mobility in my leg and that I'm still able to do the movement. So I take my time. I move really slow, but the goal is to step as normal with my foot on the ground and use my knee properly to do the little flexion. So my surgeon said for me, I have to use my entire foot to put it on the ground. Maybe you won't have the same guidelines as me post-surgery, so be really mindful of what your surgeon says depending on which surgery he performed and your personal case, because it will be always different, I think. But for me, he said use your entire body weight on your foot, just use the crutches to relieve the pain if there is any, and just go really slow. So that's what I'm doing. After a week, I decided to go on my first official walk because I was like, I need to get out of the apartment for real. And my boyfriend was like, okay, we're gonna take it slow because you haven't walked more than 5 minutes every time you stood up, you know, so we have to take it really slow. And I was like, okay, I'm gonna take my crutches. I need to use my crutches for a month. Like he said, you need to be really adamant about it, use them every day. Do not even think about not using them because you can hurt yourself. I was like, no worries, I'm gonna use my crutches wherever I go. And my first walk after a week was supposed to be a 7-minute walk. You know, Google Maps tells you how long it should take for a normal person to do those steps, and Google Maps said 7 minutes. Well, it took me 30 minutes round trip to do those 14 minutes of walk, so round trip. It's okay. It was the biggest walk I have done in a week, and the night after the walk and the following day, my hip hurted a lot. I had cramping in my leg, I had a sore butt, and my scars also were really tensed, and it kind of all hurt. So I started cryotherapy a bit more than the past days, and now it's all good again. So I think after surgery, you just need to take it slow. Some days are going to be easier, some days are going to be harder. Just rest. And one other thing I have done is told people around me I don't want visits. Right now I just need to focus on myself. I don't necessarily want visits before week 2, and it's nice. The first week I was feeling shitty, I was feeling tired and sleep deprived, so I just slept on the recliner chair. I watched some random movies, some random TV shows, and I was doing a lot of naps, and that was my first week. And if you want to know how was my week too, if you're interested, well, I will put the link of the video in the description box, and you can obviously in the comments share your experience, which kind of surgery you're gonna get. I would love to know. And if you have any questions, well, please ask them. I hope this video helped you at least a little, and I wish you a beautiful day. Salut!